Hello, everyone. Good evening. Olá, pessoal. Boa noite. Sejam todos bem-vindos. Welcome to our live session. Tonight, I have a really special guest, Jack Was, who is an OET education specialist, and he's going to talk about the writing test, and he's going to explain how the test works and also give you some tips to succeed in the test to get a really high score. And let me invite him. He's already here, ready to join us. Hello, Jack. Good evening. It's a real
Hello, good
pleasure to be
evening.
with you tonight.
Absolutely. Thank you so much for the invitation. It's great to be here. It's always a pleasure to get to do these sessions with you to talk more about different aspects of the test. So thank you.
All right, thank you for being here. And can you introduce yourself to our
Absolutely.
audience?
Absolutely. So my name is Jack Waz. I'm the education specialist for OET. So I work closely with candidates that are looking for more information about the test. I do a lot of informational webinars like these that talk about resources and different skills that they can do for the different subtests that we have. So this session will be focusing all on writing, but we also have resources for the different parts of the test as well. So yes, thank you again, and it's always a great opportunity to be here.
All right, so first, guys, Jack can speak Portuguese because he spent some time here in Brazil, in Bahia,
In
right?
Bahia, in
In
Bahia.
Bahia. So
Mhm.
how was your experience in Bahia?
It was a great experience. I was there for 6 weeks at my last year of university, and it was a great experience going to the beach all the time. And I went to Praia da Forte as well. I got to do some sightseeing. So yeah, so it was a great experience. I loved it.
We have a lot of experience, a lot of students from Bahia.
Okay.
And yeah, my family is also from Bahia, so I know the place really well. And can you say something in Portuguese? Guys, you can speak Portuguese really
Uhum.
well, right?
Posso falar, sim, posso falar. Não pratico muito, então esqueço algumas palavras, mas posso falar, sim.
Viu?
Uhum.
Ele fala muito bem, gente, português. Ele está sendo humilde
Obrigado.
aqui, mas ele fala bem, porque, enfim, é raro ver alguém com um português assim, alguém, ainda mais nos Estados Unidos, que o pessoal tende a acabar se escorando no inglês, né?
Uhum,
Porque,
uhum,
como todo mundo fala inglês, e o
uhum.
Jack fala muito bem. And I have seen more and more people speaking Portuguese,
Mhm.
and this is
Definitely,
great.
it is. It's definitely becoming a more popular language for sure. Mhm, mhm.
Exactly. So now let's talk about OET writing, and you have a
Right.
presentation to show us, right?
Yes. Okay, well, let me go ahead and get started. Are you able to see my screen okay?
Yes, everything's okay. Everything's
All right,
perfect.
perfect. Okay, so let's go ahead and get started here. So in today's session, we'll get to know OET writing, then review 3 key writing skills, and we'll share some tips to improve writing, and then have some time at the end for questions and answers. Okay. So we're going to start out by looking just at the basics of the writing subtest. So this might be a review for some of you that already have some more experience with OET and know a little bit more about the different parts and what they include. But for some of you, some of this information might be new as well. So to start us out, I have a few questions I would like to ask you. Feel free to write your answers in the chat. If you are not able to do so, you can just kind of think about your answer, or you can write it down on a piece of paper, whatever you prefer, but just to try to get a little bit of participation in this session as well. So when thinking about OET writing, these are the 4 questions I would like to ask. What do you have to write? Is it specific to your profession? How much time do you have? And how is the task laid out? Okay, those are the 4 questions that we have here to get us started. So I'm going to give you maybe 20, 30 seconds to think about your answer or to write it in the chat if you are able to do so. And then we'll go over the answers together. So let me give you some time to think and write.
I believe there might be some students from my OET course online. So, Isabella, Laís, are you there?
This should be a
Oh.
nice, easy piece for them then.
Yeah. So let's see.
Okay.
Let's see the comments. No.
Okay. Well, let me go ahead and go to the next slide and we can kind of talk about the answers here a little bit. I'm sure some of you guys are still thinking and still writing, but just to not keep us, get us off pace a little bit. Here we go. Okay, so in terms of the answer, the writing test is 45 minutes long in total. So that is 5 minutes of reading time, right? You look at the case notes, you look at the writing task to see what you have to write and who you're writing to. And then you have 40 minutes to actually write the letter. And you don't, you can't make notes during your reading time. You can kind of just think about how you want to start, and then when the writing time starts, that's when you're able to write. So yeah, and as we know, it's a healthcare letter that you're writing. It is specific to your profession. Typically, for nurses and doctors, it's a referral letter or a discharge summary or transfer letter. Those are the three common letter types that we see.
Yeah, and Jack, I would like just to make a comment. Guys, I think 40
Mhm.
minutes is more than enough time to write the letter. We know that writing is always challenging, but in
Mhm.
other exams, you have like 40 minutes to write about topics that you sometimes don't know anything about, like
Mhm.
AI or children education. And you know that in OET you're gonna have something really specific, some language chunks that you can also learn and memorize that you can use in the letter. So
Absolutely.
I think the timing is perfect.
Absolutely. That's a very good point. Okay, so now that we've done the quick overview of the writing subtest in general, let's take a closer look at what those case notes look like, right? As we were just mentioning, that's what you're reading in those 5 minutes. It's much more familiar to healthcare professionals than maybe AI or cybersecurity or global warming. So this is something much more specific. So as you can see on the slide, the case notes cover 2 pages. It's two pages of text. So let's dig into what's included here. So the first section to pay attention to is the notes section, which includes some of the following information: the date you are reading the case notes, which you should use at the start of your letter, right? Today's date, it says here, is the 22nd of January, 2019, for example. It also includes the patient's name and your role in the patient's care. So who are you in this situation? What is your role? That's what we're seeing in that first section, the notes section. If we go on to the next section, this is the writing task, which describes who you are writing to and why, right? So all of these are important pieces of information so you know who you're writing the letter to and why, and to make sure it's specific and, of course, as clear as possible. The remaining notes are separated into section by headings. So for example, it says current medication, treatment record, and then it has notes at different days, kind of explaining different things that happen on those days. So it might have patient details, current medication. They also detail the patient's current health needs and outline the request for the reader to provide ongoing care. So this is the information you're going to find in those case notes.
So it's important to emphasize that students don't need to make anything up. Everything they need is
Correct.
there. They just have to turn the notes into full sentences.
Exactly. Yeah, make
Yeah.
it as clear as possible. And then I think another key piece is knowing what to include and what to omit. We're going to talk a little bit more about that later. But yeah, that's I think another important piece. You don't need to include everything you see in the case notes. You kind of have to decide what's relevant and not. We're going to talk a little bit more about that coming up as well. So next thing I want to cover before we get into those 3 skills that I was talking about is how OET writing is scored, right? So we know this is information on the OET website. Both the speaking and the writing section have assessment criteria posted on the website. And on this assessment criteria, on this document, you can find the rubrics, you can find how you're being scored for these different tests and what you need to do to make sure you can get the best grade as possible. So our writing criteria determine how assessors will score your language skills. So I just want people, these are the 6 criteria listed here. The first one says purpose. So I just want you to take a few seconds to see if you can figure out any of these missing words here on the slide that mention the other 6 criteria. Maybe you're already familiar with them, maybe this is new to you, but try to engage with this a little to see if you can figure out any of those missing words, and then we'll go over those.
Okay, somebody said content, so they are participating. Great.
Very good.
Thank you for your answer.
Yeah, maybe give you like 10 more seconds to try to think of some of the other ones, and then we'll go over these together.
Oh.
Okay. All right, so let's go over these now. So we have purpose, content, as we said, conciseness and clarity, genre and style, organization and layout, and language. So that is these are the 6 different criteria. And then related to each of these criteria, there's a band score. So what are you scored out of? What is the maximum, the range that you can receive? So for purpose, your score is out of 3. And for the other 5 criteria, it's out of 7. Okay, so that's kind of how you're being scored for this specific criteria. Okay, and here you can kind of see all of those criteria listed. All right, content, conciseness and clarity, genre and style, organization and layout, language, they're all listed. And then you can also see the band for each of these. So you're marked from 0 to 3 for each of the clinical communication criteria. And then you have the score of 7 for some of those other ones. Okay. And assessors look at how you demonstrate the indicators under each criteria as well. Right, so that's kind of how you're getting that full score here. Okay, so you should aim to achieve the highest level in the descriptors for each criteria. And test takers securing a score of B, if you're looking for a score of B, you'll have to achieve predominantly scores of 2 out of 3 in purpose and 5 out of 7 for the other areas. So that's what you should be aiming for, 2 out of 3 for purpose and a 5 out of 7 for those other criteria. And just one thing to mention here, you can find the criteria and the glossary on the OET.com website. So this is the link here if you want to look that up, oet.com/ready/writing. That's where we can find this assessment criteria on the website.
And Jack, one thing some students forget sometimes is to focus on using proper grammar. So
Absolutely.
we were talking about that at the beginning of the class, and I told you an example of a student, because language, guys, is also evaluated, as Jack showed you. And I was talking to Jack about a student who was overusing passive voice. Jack, what structures are important to get a good score for language?
That's a good question. So I think obviously there's another version of this presentation that actually talks a lot more about the passive voice and how it is important because it puts the patient first. it shows a good command of grammar. That being said, there's a time and a place to use it, right? It doesn't have to be used always. If you're not talking about a specific interaction with a patient or showing them something, instructing them on something, it doesn't have to be used in every sentence. It's more just in very specific cases when you're trying to kind of put the patient first and make sure that they're the center of the sentence. But yes, on the language criteria, there's a little bit more information about those kind of complex grammatical structures that are being asked for. And passive voice is one way of showing those. But again, not something that should be used in every sentence.
Exactly.
Yeah.
So we can add perhaps linking words to that list.
Absolutely.
Some modal verbs also. So guys, you need to study grammar.
Absolutely. No, that's a very important piece and something that needs to be taken into account as well. It really does help affect your score and kind of show the assessor that you have that range of language that they're looking for.
Exactly.
So let's move on now to talk about the three main writing skills that we're going to be focusing on today. All right. So these skills are finding the purpose, selecting relevant content, and group and summarize information. Okay, those are the three skills that we're looking for. So let's start out here with the first one. All right. So the first skill that we are looking at is find the purpose. So let's take a closer look at what that entails. So to help find the purpose of the letter or of what you have to write, we're going to ask ourselves these three questions. So read through the questions and try to figure out what word is missing here. What words are missing in these three questions that you might want to ask yourself to find out the purpose. All right, see if you can guess any of them. And feel free to write your answers in the chat. Again, I'll give you about 15, 20 seconds to do that, and then we'll go over them. Okay. So again, don't worry if you're not writing all of these. If you don't have time to write in the chat, this is kind of just to activate our brains around the subject a little bit and have a little participation. But no worries if you're unable to answer. So here are our answers. We have who are you writing to? Why are you writing to them? And what is your role in the patient's care? So these are the questions you're going to ask yourself to find the purpose of the letter that you're writing. So if we take a look at these case notes here as an example, we have our first question. Who are you writing to? So based on what we talked about before in terms of where you can find pieces of information in the case notes, where do you think that we might find this information? Okay, so just think about that for a second. Where would we find this information about who you are writing to? Okay, so for those that were paying close attention when we were talking about the case notes, they might remember that this information is in the writing task. Okay, that's where you can find information about who you're writing the letter to. So for example, in this one, it says, Dr. Smith, an endocrinologist at City Hospital. Who are you writing to? Look to the writing task. Next question, why are you writing to them? Why are you writing to them? So now where would we find this information? This one is not as cut and dry as the first question. There's a little bit more, a couple spots you can look here for this one. So when we're thinking about why are you writing to them, this is where we would look in the writing task. and in the last section of the case notes. Okay, that's where we'd find that information. All right, so we can see here, pathology report reviewed with Mrs. Sharma, and then it also talks about the writing task, why you are writing to them. So that's where we'd find this information. And then moving on to our last question, what is your role in the patient's care? Okay, what is your role in the patient's care? Now this one as well, we would be looking towards the notes, at the beginning of the notes. So Mrs. Priya Sharma is a patient in your general practice who is concerned about her glucose level control. Okay, so that's where you would find this information. Just below where it says assume today's date is, it will tell you what your role is in the patient's care. Okay, so that's where we would find these three questions, the answer to these three questions that help us find the purpose of why we're writing the letter. So let's do some practice with this skill. I'm going to give you 15 seconds to answer the question, identify who you are writing to. So read through those case notes if you can, and then try to identify who are you writing to. Letter A, a patient's regular GP doctor. Letter B, a new GP or doctor. Or letter C, an emergency room doctor. So let's go ahead and start that timer now. Okay, so I know that was a really quick timer, right? We're trying to practice the skill at a similar time frame that you would have to be thinking about these things when you're actually doing the writing test, right? You want to be able to locate information quickly and know who to address the letter to and why. So that's why it's a little bit quicker than maybe some of us would like for this skill. Okay, so the answer here is letter B, a new GP or doctor. Okay, it says, for example, NB, patient has no GP in Underhill, new in town. So this is someone that's new in town and is having a first meeting with their new doctor. So that answer would be letter B. All right, next question. Why are you writing to them? So same thing, take that time to try to read those case notes and figure out why they're writing to them. Letter A, to outline the patient's case and transfer care of the patient. Letter B, to refer the patient to another specialist, outlining medical history and your assessment. And letter C, to outline the case, your findings, and request investigation. Here we go. All right, I'm giving you guys a few more seconds here to keep thinking about the answer. All right, so the answer here is letter C, to outline the case, your findings, and request investigation. Okay, and again, you can see that here at the end of the final section of case notes, it says requested recommendation, and if you're reading the writing task, it gives you a little bit more information about why you're writing to them. And the last question here, what is your role in the patient's care? A, you are seeing a new patient who has consulted you at the clinic where you work. B, you are advising a regular patient of yours about a new problem. Or C, you are assessing a patient that has been referred to you. Okay, here we go. All right, so if we think about this one, based on what we're reading here in the notes, we can tell that our answer here is letter A, right? You're seeing a new patient who has consulted you at the clinic where you work. So now let's put all three of these questions together, all right, for this activity here. So it says, read the relevant sections and find the purpose. And by doing so, we're going to answer these three questions. Who are you writing to? Why are you writing to them? What is your role in the patient's care? So we're going to try to answer all three of these questions with the case notes that we can see here. So this one I'm going to give you a little bit longer, 60 seconds. So try to write down as much information as you can after you finish reading those notes to try to identify that purpose of what you're writing here. Here we go. Okay, so hopefully you're able to kind of put that skill to practice and understand some of those pieces to help us identify that purpose here. All right, so here are our answers. You are writing to a cardiologist referring Mrs. Bennett. Mrs. Bennett has had side effects from her meds, and you are writing to request a review of medication and ways to encourage lifestyle changes. You also need to outline her history and treatment so far. And lastly, you are Miss Bennett's regular GP, and she has been seeing you following her recent hospitalization. All right, those are the pieces that we needed to identify the purpose of this letter. So let's finish off this skill with a few tips. Focus on finding the purpose of the letter first before you start writing. Ask yourself those three questions consciously, right, in order to help you identify that purpose. Use the layout of the case notes to do this during the reading time. So really practice with where you can find the answer to those three questions so that when you're actually writing your letter, you can go right to those spots of the case notes to find your answer. And lastly, look for further context in the final section of the notes.
All
Okay,
right,
moving
and
on.
can I
Go
just
ahead.
add something very fast?
Absolutely.
All right, guys, you need to remember that you need to state the purpose of your letter in the first paragraph, because I've noticed that some students do that, like in the second and sometimes even at the end of the letter. When you write a letter, especially a letter like this, you need to be really objective and you need to inform the person like right away what the letter is for. So do that in the first paragraph, please. Don't forget this tip.
Absolutely, that's a great point. Yeah, these are, again, you're writing to another healthcare professional, so they want to know right away what is the letter about, right? They don't like to waste time or have to read really far in order to figure out what you're writing about. So make sure to include that up front. Absolutely. Okay, so for selecting relevant content, I want to start out with a question here. True or false? You must always include medication information for new readers who do not know the patient. What do we think about that? Is that true or false that you must always include medication information for new readers who do not know the patient? So just think about in the past, maybe you've had to write a letter similar to this, or you've had some experience with this. Is it always important to include all that medication information? So the answer here would actually be false, right? You don't always have to include medication, only if it's relevant for the person that you're writing the letter to, right? That's kind of gets to the importance of why selecting content, knowing what to include or omit is really important, because you don't always have to include that, right? And depending on who you're writing to, what the purpose of your letter is, oops, maybe that's not relevant information and is just not necessary to be included in the letter. So it might not be necessary for you.
Yeah, for example, if the patient is being referred to a doctor to treat, I don't know, diabetes, you shouldn't include information about a medication that the patient takes for, let's say, migraines, for instance. So be careful
Absolutely.
about that.
Absolutely. If it's not relevant, no need to include it. So this is what going back to that assessment criteria, this is what the assessment criteria has to say about content. Audience awareness is key here. The writing needs to be appropriate to the reader, their knowledge of the case, and what they need to know to continue care. So this is what we have to keep in mind when we're selecting content. So one way you can think about this is by asking yourself these two questions. Is there an existing relationship with this patient? And what does the reader need to know to continue care? So to answer this first question, let's repeat some of the steps we saw for finding the purpose, okay, with an example here. So again, our question is there an existing relationship this reader has with the patient? So look at the writing task for clues. So in this example, we can see that we need to write to the community health nurse in Centerville. I can look for more clues elsewhere. So let's take a closer look here, right? So, right, the writing task here, write a letter to the community health nurse, ongoing monitoring, address the letter to the community health nurse, Eastern Community Health Center. So it has information about who you're writing the letter to. If I read the first section, I can see my role, right? I'm a community health nurse and I see my patient is moving to another city. So let's take a closer look at that section. You are a nurse in the community health center. A patient you have been monitoring is moving to another city to live with his daughter. Okay, so that's another thing to keep in mind here. Now, the next section we're going to look at here is at the end of the case notes. Okay, so let's go ahead and take a closer look at that. We'll make it a little bit bigger here. All right, so the final section of the notes, it gives me a little bit more context and also tells me this is a letter of transfer, right? So that's the type of letter that we're writing. The care of the community nurse in Centerville, where the patient is moving to live with his daughter. So based on all this information that we just read about why you're writing the letter, who you're writing it to, what is your role, when thinking about those three things, let's try to answer this question. Is there an existing relationship this reader has with the patient? What do we think here? Give you a few seconds to think about this. Okay, so based on what we read, based on these case notes, we can see that the answer is no, right? The patient is moving, the patient is going somewhere else. It's a transfer letter, so they're moving care from one center to another center in a new city. So there's not an existing relationship with the reader. This is a new patient that's going to be seen by the community health nurse. Okay, so the next question you need to ask is what information the reader needs to continue care. So let's imagine you are writing about this patient, Mr. Dunbar. All right, so let's read the situation. You are a community health nurse. A patient under your care is transferring to another city. He has signs of diabetic neuropathy and is not adhering to his diet and medication regime. All right, so here are the two scenarios for you when thinking about this information. A nurse in a new city, you're writing a letter to a nurse in a new city to request monitoring of compliance to diet and medication. Is this patient complying with their diet and medication? And the next scenario here is imagine you are writing a letter to the patient's regular doctor to request the review of medication before he leaves. So when thinking about those two scenarios, a nurse in a new city or the patient's regular doctor, tell me which pieces of information you think would be relevant to include in the letter. So we have these 5 pieces of information. Non-compliant with diet and medication, blames poor memory, metformin, 500 milligrams 3 times a day. In December 2017, the wife of this person's wife deceased, and the daughter will cook, requires education, patient needs, and monitoring. So think about those 5 pieces of information and then take a look at those 2 scenarios we have. You're writing a letter to a nurse in a new city, or you're writing a letter to the patient's regular doctor. Which pieces of information do you think we would have to include in those 2 scenarios? Let me give you about 30 or 40 seconds to think about this, and then we can kind of go over this together. What information would you include for both of these scenarios? Okay, so here are the answers. So there's a lot of similarities, right? The first 3 pieces of information, non-compliant with diet and medication, blames poor memory, metformin, those are things that would be included to both of these, in both of these scenarios, to the nurse in the new city and to the patient's regular doctor. Now, the last 2 pieces of information, the fact that the wife is deceased and that the daughter will cook and requires education for monitoring, that's not necessary for the review of medication before the patient leaves, right? That doesn't really have any impact in what medication he would be taking, but it is important for the nurse, right? The nurse is trying to see if he will be compliant with his diet and medication, so he needs to know who will be cooking, the fact that that his wife is deceased. So just more information about the specific case. In that case, it would be relevant to include those pieces of information. So that actually brings us to our last skill now, summarize and group information. So we're going to actually start out with some tips for this one. Summarize and group information. So to summarize effectively, you must leave out unnecessary details outside the scope of role in care for the patient. You must also avoid too much historical detail or background information, right? That might make the person miss the relevant information that they're looking for and just provides too much information. It might confuse the reader or just overwhelm them with an excess of information. And lastly, you must group similar information from different sections of the case notes together, right? So maybe the information is in different parts of the case notes, but if it goes together and is relevant, as a grouping, make sure to put it together in your letter. You might have to move pieces from different parts of the case notes and put them in the right order based on how it makes sense to the flow of the letter. Okay, so, and this also, if we're taking a look at that conciseness and clarity section of the assessment criteria, you are asked to consider irrelevant information. What doesn't the reader need to know? And lastly, how effectively the case is summarized. No time is wasted for the reader, right? As I mentioned, these are busy healthcare professionals, so we can't be wasting their time with relevant or disorganized information. So yeah, just think about writing to someone like yourself on the ward or at a clinic. Imagine you get a letter about a patient you need to read. What would you want to know from the letter, right? You want to get a clear picture of the patient's case and understand what you need to do next for them. You don't want to waste time reading through irrelevant details or long paragraphs that aren't connected to your role in their care. So this is kind of what that criteria is all about. Now, let's take a look at Mr. Dunbar again. Okay, so as a reminder, this is the case. A patient under your care is transferring to another city to live with his daughter. He has diabetes and is non-compliant with diet and medication. You are writing to a community nurse in the new city to outline his history and request monitoring. Today's date is 22nd of January, 2019. So thinking about that case, which of these case notes are unnecessary to the reader, right? A lot of time case notes have information about hospitalizations. All of the notes seem important, especially because you don't want the reader to miss out on any details. But remember, the reader only needs to know what would directly impact their role in care. So thinking about that, looking at these notes about a hospitalization in June 2018, you're thinking about this, writing to community nurse in the new city to outline his history and request monitoring. So think about what information from this would need to be communicated to the reader. Okay, so these are the pieces that we believe are the most relevant, right? The patient is hospitalized with myocardial infarction and diagnosed with arterial fibrillation post-MI, commence sotalol and warfarin. Those other two pieces in the middle, talking about the prior hospitalization, are not necessary to this new situation of monitoring diet and the new plan that this person has to follow because of their diabetes. So that it's just not crucial pieces of information. They don't necessarily need to be included. So again, if we're looking at tip number 2 here, it says avoid too much historical detail or background. Again, some of this could distract the reader. In Mr. Dunbar's case, there are a lot of notes about diet and medication. Now, because the community nurse you are writing to needs an outline of his case and will need to monitor him, some of the notes will be relevant. But let's think about whether all of the detail and background to diet and medication needs to be included, right? Diet and medication. So, all right, we're going to do another little activity here. So when it concerns Mr. Dunbar, his notes record a series of visits where his diet and medication compliance was noted. What aspects of his noncompliance would be too much background for the reader? We've highlighted the notes about diet and exercise here for you to focus on. So go ahead and think about what aspects would be considered too much. Specific dates noncompliance is recorded, foods to avoid, or alternatives in education discussed in each visit. So go ahead and read through these and think about what you might want to omit. Okay, so based on this, we have our answers here. What information would you want to omit? The specific dates of noncompliance is recorded, and the alternatives in education discussed on each visit. Those are not necessary pieces of information for this future monitoring that you're requesting. But the foods to avoid, we would want to, of course, include, because that is important for the nurse to know. Right, you can leave the specific dates out of the letter because you want to give the reader a summary or outline of the case so they have enough information to continue their role in the patient's care. Now, for the final task, okay, we're going to do another task here on this next slide. So this is all about medication. What aspects of non-compliance to medication would be considered too much historical detail or background? A, specific dates non-compliance is recorded. B, the patient's reason for non-compliance. And C, education provided on every visit. Okay, so let me go ahead and start this timer. All right, so our answer here, what would be is too much, or what should we omit? The specific dates and non-compliance is recorded, and the education provided on every visit. Those things are not necessary. You can of course use summaries or high-level pieces of information, but not those specific details. Right? You want to give the reader a summary or outline of the case so they have enough information to continue their role in the patient's care. So now let's try writing a summary of the diet and medication aspect. So I am going to give you about a minute to do this. So take a look at those case notes and how would you complete this summary about the diet and medication of the patient. Mr. Dunbar's type 2 diabetes is controlled by metformin and through his diet. However, so take a minute to think, how would you complete this summary? What piece of information would you include? All right, so let's go take a look here. Of course, there's more than one way that you can say this. This is just one, one way that you could say it. However, he has not followed his dietary recommendations or medication regimen, blaming poor memory as the cause of his neglect. This is just a very high-level summary. Of course, there's different ways that you could address this. And the next tip is about grouping similar information together. So remember, relevant case notes are scattered throughout under different headings. So you need to decide which ones can go together in the same sentence or paragraph in a way that makes most sense to the reader. Okay, so we have this piece here, blaming poor memory as the cause of the neglect. So this is the summary that we just wrote about diet and medication. So what other notes would be relevant in this paragraph? June 2018, prescribed Ramparil 5 milligrams daily, diagnosed with atrial fibrillation post-MI, commenced sotalol and warfarin. December 2018, patient now walking with a stick or cane, signs of diabetic neuropathy, restricted mobility. Letter C, refuses to reduce salt, sugar, alcohol, fatty food. Letter D, still misses or double doses all medication. And letter E, daughter will cook, requires education regarding patient's needs and monitoring. What other notes do we think would be relevant in this paragraph? Okay, so the answer here would be basically all of them except the first piece, talking about medication. The other ones are all talking about mobility, about diet, about exercise, things like that. But the first one is talking about medication for that specific case. So it's just not necessary information to include for this piece, for this paragraph. Okay, and lastly here, I'm going to ask you guys to complete this paragraph using pieces from the case notes. So take a minute to complete this paragraph. We have 1, 2, 3 pieces of missing information. So go ahead and start that minute now. All right, so here we go. Our answers. Number 1 has not stopped consuming. Number 2 has shown signs of diabetic neuropathy and has had restricted mobility. And number 3, his daughter will be cooking for him now. And again, there might be other ways that you can say this. This is just one way to put this. So we're going to finish off this section with some tips. So to summarize effectively, you must leave out unnecessary details outside the scope of role in care for the patient. As we said, our second tip that we are thinking about is you must avoid too much historical detail or background information. And as a reminder, our last tip, as we just worked on, is to group similar information together. So let's finish off here with some useful resources and tools to improve your writing before test day. So some resources for writing. First thing would be the sample case notes on our website. There are 5 free sample tests for your profession on OET.com. Next good piece of information would be the blogs. So you can find answers to frequently asked questions about writing and different tips on how to succeed. Another helpful resource are the graded sample booklets. So see real responses to OET writing tasks by candidates, and also the grades and assessor feedback that they receive. So this gives you information of what actual writing looks like and what the assessment looks like for that writing. Lastly, the assessment criteria. So understand the criteria assessors use to score your writing. And we talked a little bit about that already, but feel free to take a closer look at that criteria to understand it a little bit better. One way you can get a closer look at this is the Ultimate Guide to OET Writing. So it talks more about the assessment criteria, gives you some more descriptions and some useful information about that. So feel free to check this out on the Ready page, OET.com/ready/writing, or you can just Google the Ultimate Guide to the OET Writing Subtest. If you Google it, it should come up as well. But of course, you can find it in on the Ready page that addresses writing. We also have our an official writing course on our website. So it costs around 30 Australian dollars, which is about 18 or 20 USD. So it has a lot of information, including skills, strategies, and sample tests, including real tests with assessor scores and comments. There are also some useful language workbooks at the end to work on your grammar and vocabulary. And you can find this, this course in the OET store. All right, so we're going to finish off our session here with some final tips. Find the unique purpose of the letter you are writing. Write with the reader in mind. Avoid irrelevant details, too much background or history. Present a clear summary of the information that you are sharing. Understand the focus of each of the assessment criterion. And lastly, make sure to proofread your work before you submit your letter. All right. This is just the last piece here. Feel free to check out our social media channels for more information. And with that, I am going to stop sharing my screen and we can turn it back over to questions. Okay, so let me stop sharing here and see what remaining questions we have about OET writing.
I can see there are some students of mine here, Isabella, Renata, and Shayla. Do you have questions, ladies? Now, this is your opportunity. I have some questions, but I'll wait for their questions first.
Absolutely.
And I loved the exercises. I think I'm going to include something like that in my course because I think it makes students think about what they have to include and what they shouldn't include in the letter. I think Brazilian people might struggle a lot with the social history and background because we are not objective people, you know, we like to talk about our lives and to know about other people's lives. So sometimes I see that my Brazilian students feel that everything is relevant.
Yeah, yeah. Absolutely. I do see a question here from Hinata. Do we lose marks for writing more than 200 words? So that's a great question. Obviously, the recommendation is to keep it between like 180 and 200 words. That being said, if you go a few words over, you're not going to get a bad score on your letter, right? Of course, the important piece is being clear, being concise, conveying your message, you know, sharing the information that you're supposed to share. But, you know, you're not going to automatically fail if you have 201 words. But that being said, try not to go too much over the limit. That might mean that might be a time for you to ask yourself, am I including too much information? do I have to, should this be omitted? Is this necessary? So that the letter count, the word count rather, is something that they have in mind based on the type of information you should be sharing. So if you have way over 200 words, that might mean that you're providing too much background or sharing too much information.
Exactly. And also some students think that if they write more, they're gonna get a higher score, just because they wrote more. But that might be true for other proficiency exams, but not here for the OET. I think the main goal is to write a letter that is objective enough and that includes only relevant information. And we have another question. Do we need to sign our name at the bottom of the text?
That's a great question. So you don't have to sign your real name. You can obviously, you should make sure to end the letter with an appropriate closing, right? Yours sincerely, yours faithful, something like that to kind of close out your letter. And then you should use the role name given in the task, right? Are you a doctor? Are you a general practitioner? Are you a community nurse? You should use the title that is assigned to you when you're reading your role in the case.
And also, guys, we need to remember that there isn't like only one way of writing the letter. As long as what you were doing is compatible and is correct, would be correct in this context, it's okay, right?
Absolutely.
And or about the formal connector that he used in writing. I think he means like the linking words and connectors that should be
Yeah,
used in writing.
absolutely. So obviously, those linking words are really important, and they do kind of show that you have a command of the language, that you're using your grammar correctly, and can also help in kind of organizing your letter, right? If you're trying to put things in order or make sure that's clear to the assessor. So yeah, you can use it for adding information. In addition, furthermore, showing contrast. However, on the other hand, you can show it to kind of show an effect or consequence. Therefore, consequently, or as I said, putting things in order. Firstly, secondly, following this, subsequently. So there's definitely ways you can use those formal connectors, but I don't want people to get too tripped up on that. It doesn't mean that if you don't use them, you're not going to get a good score. You just have to make sure that you're using them correctly, and only if they're necessary to kind of in the
Exactly.
structure of your letter or to make things clear. Because sometimes
Yeah,
people might try to use them in situations where they're not needed, and it can make it have the opposite effect, make it unclear what you're trying to talk about.
exactly. Then that your speech may sound unnatural
Yes.
because you're adding like sometimes they don't even know how to use the linking words, but they see them, they think they're beautiful, and they start using.
Mm-hmm.
So I think the secret is like only using linking words when they are really necessary and relevant. So don't overuse them just to
Yeah.
show off your level of English.
Mm-hmm. Mm-hmm.
And we have one more question here. Use the same words as the case note is okay, or it will be better to do more paraphrasing.
Yeah, I would say definitely paraphrasing, because you're trying to make it as as succinct and summarized as possible. That being said, you can use pieces of information, right? If they're using a specific phrase, or if they're talking about, for example, something in the last situation, they're talking about diet and exercise and not complying to that. So if they're referring to something very specific, you can use those same words. But if it's a longer piece of information, definitely paraphrasing is better.
Yes, but there is a problem because some students think they should never use the same words, and they try to come up
Change
with
everything.
crazy
Yeah.
synonyms to some
Mm,
words. Guys, it is totally okay if you include
yeah.
some
Yes.
words. You shouldn't like copy full parts
Exactly.
from the case notes and add them to your letters, but like using some words will be necessary, actually.
Absolutely. Yeah. Some
Yeah, in
phrases,
some
some
parts.
words. Yes, that's definitely okay. You don't need to change everything. It's more about making it shorter than using different words. You shouldn't focus too much on using different words. Just summarizing it and making it shorter. Mhm.
Yeah, guys, remember, like OET is different from other proficiency exams. In other proficiency exams, you have to show off, to use like very difficult words. The purpose here is communication in a setting, like in the healthcare setting.
Mhm.
This is the main purpose. And I have some questions. We have already talked about passive voice, about being
Mhm.
careful when using it. It is important indeed, but um, sometimes people overuse passive voice and
Yes.
they gotta be careful. And we have already talked about the number of words that was a question that I also had. And the social background, guys, be careful if you are Latin people. You
Mhm.
gotta try to be more objective in writing your letters. Okay.
Mhm.
And what are the most common mistakes in OET writing? Like three mistakes.
Yeah,
Which
I
ones
would
stand
say
out?
absolutely. I would say one of them is something that we've covered today already, which is talking about including irrelevant details from the case notes, right? So again, if you're just copying everything from the case notes and just writing in there in long paragraphs, even if it's not clinically relevant to the reader, then that kind of interferes with the flow of your letter and makes it a little bit clunky. So that's definitely one. I would say the next one is kind of maybe not using the correct tone and style in the letter. So, this is a formal letter that you're writing. You're writing to another healthcare professional. So you have to make sure to use professional clinical tone that matches the audience that you are writing to. So make sure to kind of keep that language in mind. And obviously the case notes give you an idea of what that tone should be, but also just kind of think about the situation. How would you communicate with a colleague and make sure that you're still being professional? And then the last thing is also kind of one that we talked about today is weak organization and cohesion, right? So if your letter, I think it's really important. I really like the idea of taking different pieces from the case notes and putting them in the right order that works for your letter. So that's definitely something that you should do, right? You don't want to say, oh, this was in the case notes from 2017, so I'll include that first. And then this piece is from 2019, so I'll include that later. No, you really have to group them together to make sure that everything that's talking about diet is together. Everything that's talking about medications or adverse reactions, put that
Exactly.
information together so it's easy for the reader to
Yeah.
understand. So I
So
think
guys,
sometimes people might focus too much on grammar and some of these other things when there's a lot of other pieces to keep in mind too. It's not only, using fancy words, it's all about organization
exactly.
and planning. Mhm.
Exactly. So paragraphing is very important, guys. You gotta know how to organize your paragraphs and, you know, like add information that matches.
Mhm.
And also something that I think is crucial to address. I see that a lot of students they want to memorize templates to
Mhm.
use, and I always tell my students, guys, you gotta learn how to write because the examiners and the
Mhm.
people who are going to analyze your letters, they are trained to spot overused and memorized language. So,
Yes.
what do you
Yes.
have to say about it? Please say it yourself because sometimes my students they don't
Mhm.
listen to me.
Absolutely. So I think understanding templates and formats is important to know, what should you be focusing on in a specific letter? What type of information should I be including? So it's good to have a general understanding of the different types of letters, right? So what's important in a discharge letter, what's important in a transfer letter. So knowing those components is important. But if you're just memorizing a specific format, mention this, then that makes your letter less personalized. It makes it less specific to the context of the case that you're dealing with. So and it might make if you're focused on a specific order or organization, it might not flow with the way that things are structured in the case notes. So it can really get in your way. Sometimes the formats, those templates, you might be doing it to make things easier, but it can really get in your way if it's not done correctly. Instead, you should focus on those other pieces that we mentioned.
Alrighty, so any other questions? Yeah. no, Isabella was the last one. So, guys, thanks a lot for being here with us. I think this class was very productive. Thanks a lot, Jack. I love the class. I love the exercises. This is something that I'm gonna include in my course, like definitely,
Absolutely.
because yeah, they're so useful and make students think and not just like receive information. So
Mhm, mhm.
I loved it. I also learned a lot from today's class. So, well, I hope we can talk again soon.
Absolutely. Yes.
I'm gonna start making more videos about OET.
Mhm.
And well, this is it. So I hope you also had a great time with us here.
Absolutely.
And
Mhm.
guys, thank you. Thank you once again for being here and have a great night, everyone.
Thank you everyone for participating, and thank you, Soraya,
Bye
for the invite as
bye.
well.
Bye, Jack. Thank you.
Bye.